Before starting any new health program or before you begin taking any medication or supplement, always check with your primary healthcare provider.
Welcome back to Wylde on Health. Gas, bloating, cramping, digestive disorders is an embarrassing topic, let's admit it, and naturally not one that most are jumping at the chance to discuss with friends, family members, or even their doctors. You know, the Canadian Digestive Health Foundation is trying to change that, and they've developed a GI Bodyguard. It's a free and innovative app allowing those suffering to quickly, confidently, privately track the activities of their gastrointestinal system. And I'll show you folks momentarily what this looks like. But let's talk real quick about this whole concept. I mean, you know, either of you, do you have this? I mean, I certainly can resonate with this idea that patients, it's like pulling teeth. They have a hard time discussing their poop. And what the folks at Rexall designed this app want everyone to do is forget about what mother said, you know, go ahead and have a potty mouth, right? So do you guys have that experience in your practice?
Initially, yes, and I encourage patients because I ask them to bring in stool samples from day one, and so I quickly, you know, get over that sort of hump, and I also insist, you know, that they do occult bloods on a regular yearly basis, and anybody who's hit age 50 has a preliminary colonoscopy, and if they have polyps or a history of any kind of colon cancer, they have to be followed regularly. So you have to be sure that it's not other things other than irritable bowel.
Absolutely. Dr. Trotter, you have an app on your phone. You're going to share the app that you have momentarily after I share this one, but is it easy for you to get your patients, you know, talking about
you know, like Dr. Bested said, initially there could be a little bit of a barrier, but once you open the floodgates, then all the information comes out, which is great.
Does it sink? Does it float? What does it look like? I'll tell you what, I have my patients bring me pictures, to be honest, and sometimes I can't really understand, you know, what. There is, in fact, a Snellen stool chart. Anyone out there wanting to, you know, see, you know, how they should best describe? It's a Bristol or Snellen stool chart, just like a Snellen eye chart. You know, print one of those out on your computer and bring that to your doctor and show them, this is what my poop looks like. It means the world of difference, totally related to your health. So, again, the folks at Rexall here developed this free, by the way, little app. And I'll show you how this works. It's basically on the premise as a quick log, right? So you can stick in your you know, your trends, my stool, the form, have a little, you know, up and down function there. Whether it's blood or not, this is really important. You heard Dr. Bested say you should be checking for occult blood. Urgency levels, you know, gas and bloating, maybe that was mild. Was there constipation? Yes. Anyways, log it, and there you are. And then it'll give you sort of pain trackers. And all this stuff is loggable in seconds, in minutes. And this is really what's important is once you log this information, now you have a trackability, because constipation is a lot less about frequency. It's about a 3-3 rule. You don't want to go more than 3 times a day on average, but you also don't want to not go at least, you know, once every 3 days. You want to be able to have some regularity. But this will help you track it. So I'm going to hand this over to Dr. Trotter. We'll pull open his favorite app, and it's the Poo Log. You know, tell us about the Poo Log. What's your poo telling you? I like this. Hold that up a little higher for the camera.
All right. So the Poo Log might not be as comprehensive as the app that Bryce was just discussing, but it's a fun way to get patients just to get used to, be more comfortable in terms of discussing their poo and the texture of the poo and the quality of the poo. This was developed by 2 medical doctors. There's a great book we had in our reception waiting room called the Poo Book.
Yeah.
And so essentially, basically, the timer starts as soon as you open the app, and you can indicate new poo, and then you can describe the delivery, the size, the shape, the number of particles, and it's all delivered with a humorous twist.
I love it.
And
what's your poo telling you? The food like, and I love this, the fact there's this whole chart and you can sort of track over time and ultimately gain good information from this, totally relevant, especially if you're experiencing irritable bowel syndrome or leaky gut syndrome, because it's very important information for your doctor. Excellent stuff. Well, look, let's go to a quick discussion about foods to avoid after we take our first call, at least here. We've got Mark who's calling in from Toronto. Welcome to the show, Mark.
Hi, Bryce.
How are you?
I just have a question for the panel.
Sure.
How does the consumption of wheat contribute to things like fibromyalgia or neurological disorders like Parkinson's and Alzheimer's? Thank you.
Great question, Mark. And we were just about to talk about food, so perfect timing. I'll ask you first, Dr. Bested, because I know this plays into ME, fibromyalgia, chronic fatigue. How?
Well,
wheat, gluten.
Gluten in some people causes the body to have more inflammation. So we're talking about a food sensitivity here as opposed to a food allergy. And what happens is the body, when it's subjected to things like wheat or gluten, the body produces things called cytokines, which are momentary molecules that appear in the body, but it does cause inflammation, and it can worsen the symptoms of fibromyalgia, and I would assume probably the other conditions too. So I think the thing is, what we do is we try to figure out which foodstuffs we need to avoid, and how you can do that yourself. If you don't have access to these lovely tests, you can do what's called an elimination reingestion challenge test.
Yes.
So you can take the wheat out of your diet for 7 days, and then on the 7th day, before you have breakfast, maybe have a quarter cup of cream of wheat. And what you would do before you actually take the cream of wheat, you would take your pulse for a full minute, check in with yourself, see how you feel emotionally, and have a look at your skin in the mirror to see how red or how pale your face is, and then eat it. Eat the cream of wheat, a quarter cup, and check your pulse and see how you feel. And if things change, if your pulse goes up, if your face gets flushed, or if you break out in hives, or you get short of breath, you know this food is having an adverse effect on you.
Great way to start. And we're talking here about major intolerances when we're talking about celiac disease. And I'll tell you folks, 1 in 100 people approximately have full-blown celiac. 97% of those individuals with celiac don't even know they have it. That's the scary statistic. So, Dr. Trotter, do you see a lot of sort of borderline celiac, pseudo-celiac, wheat intolerant?
Pseudo-celiac, yeah, and part of the problem with celiac is it's difficult to get the diagnosis because there has to be reintroduction of gluten. So with the blood
most people have identified the fact they're not feeling well from it, taking it out, and they go to get tested, and their family doctor's blood work says, no, you don't have it, but it's because there's none of that antigenicity brewing, right?
Absolutely,
in the system.
yeah. And a lot of people with celiac just don't want to take the risk and suffer the consequences.
Right.
And it is actually a tax write-off for people who have the diagnosis of celiac disease to write off gluten-free products, which can be expensive.
Absolutely. And let's remind folks, too, as well, that the gold standard of testing is a biopsy when we're considering celiac disease. But there's beyond celiac, there's a gluten intolerance. On to Thomas. Hope that helped, Mark. On to Thomas, who's also calling from Toronto. Welcome to Wylde on Health, Thomas.
Hi, how you doing?
I'm good. How are you?
Not too good. That's why I'm calling.
Tell us. Yeah.
I got diagnosed with IBS a while back with my doctor, but I haven't really been given any direction because of the busyness of medical practitioners, understandably. But the head and gut connection, I really like that because I find I have a bit of a high anxiety level at times, and that's when the IBS really triggers. So I'd like to know what I can do for that.
Yeah, you know, yeah, thanks so much for the call, Thomas. It's a very important one. The brain is connected by all kinds of neural channels down to the gut and vice versa. There's a lot of channel and signaling from the gut up to the brain. I'm going to start with Dr. Trotter because you mentioned sort of this in concept of a mini brain. The gut is like having a mini brain. You know, and you also alluded to the importance of food antibody or food allergy testing. Might that be something that Thomas could try, and what else?
Yeah, absolutely. So Thomas did bring up the anxiety component that can aggravate gut health. And there are the same neurotransmitters in your brain as there are in the digestive tract. So that's an important thing, is to look at stress. Now, as humans, we're very multifactorial. We're not simple creatures.
Sure.
So there's going to be a lot of components. So things like we have to investigate food allergies, we have to investigate diet, stress management. So it's not just as simple as one thing or another.
Absolutely. Okay, well, look, we'll probably get more into this after the break. But up next, where we're going to focus, we'll tell you what you should be doing to improve your digestive health. Thomas, stay right there, along with all the rest of you. Plus, by the way, we're giving away a VIP pass, multiple passes, in fact, to the Whole Life Expo. That's happening next weekend, November 25th through the 27th at the Metro Toronto Convention Centre. We'll be filming there next Friday, and you could be a part of our first time ever live audience. Give us a call right now for your chance to qualify. Stay there.
Reach us in the GTA by dialing 416-872-2724 or outside the area at 1-888-863-2724. Send an email to wildonhealth@cp24.com or follow Bryce on Twitter by visiting cp24.com.